So there's a very particular brain region called the hippocampus that is important in memory function. And we were very interested to see how its connections to other parts of the brain would change with exercise. And so in the pilot study, we saw that, its change in the hippocampus connection was associated or related to their improvement in memory function. And so in this larger trial, we are really looking to test that. Is it because of the changes in these functional connections with other brain regions? Is that what is driving these improvements in memory improvement in people with epilepsy?
Welcome to Epilepsy Sparks Insights. I'm your host, Tori Robinson, and today I'm joined by Associate Professor Jane Allendorfer, who is going to be sharing with us how exercise may improve memory in people with an epilepsy. Up to half of people with an epilepsy report cognitive difficulties, particularly memory, even when their seizures are controlled. So today we are exploring early evidence from a pilot study involving a structured exercise intervention, which has shown measurable improvements in memory over just 6 weeks, with brain imaging data suggesting positive changes in hippocampal connectivity. We will also talk about Jane's latest randomised clinical trial and why this could shift how we think about memory rehab in epilepsy. If you're new here, please subscribe so that you don't miss future conversations, and let's get into today's episode.
In other disorders and neurological disorders, exercise has been utilized as a complementary therapy to help enhance cognitive function, particularly memory function. And when I started looking at, the epilepsy research, I didn't see much of that. Up to half of the patients with epilepsy have cognitive complaints, and that doesn't, rely on whether or not they're seizure free. The top cognitive complaint is actually memory function.
Interesting. And we were speaking a bit about this beforehand, and you gave me a great example of somebody who was a top shot lawyer and with his epilepsy, despite how his performance appeared to other people, he could still tell that his cognitive function was impaired by his epilepsy.
Absolutely. And this person tested above average on all of the cognitive assessments that were part of the study. But then when asked, whether or not they feel like epilepsy or seizures have affected their cognitive function, they're like, absolutely, I am not at the level where I was before. And if something can help improve that, I'm willing to do it. And so they were actually part of the pilot study that I had years ago.
So tell us about this pilot study then. What was it called and what did you do?
Oh, so it was a combined endurance and resistance training program. It was very short, 6 weeks. Most exercise intervention studies are actually 12 weeks or longer. But I wanted to just see if there was a signal with respect to, a change in memory before and after exercise. And then also, people with epilepsy, it's hard to get them in multiple times. And so I wasn't sure if we could get them in for 12 weeks. I figured if we can get them in for 6 weeks and see a signal with respect to memory, that's a plus. And also because it is combined endurance and resistance training at a moderate intensity, a lot of people with epilepsy are not very active. And so being able to actually just get them in and do the intervention itself would show feasibility. So we were able to do that with a small set of patients. About 8 or 9 of them were able to do the intervention. And then we had another 8 that were a control group that didn't do the intervention. It was just 6 weeks of, their everyday activities.
Just to clarify for all our listeners, are we talking people who kind of have average IQ, people with a degree of intellectual disability, people who are all like the lawyer that you mentioned? Did they have many comorbidities?
We didn't exclude based on seizure freedom. So we took them whether or not they were seizure free. A lot of the studies actually focus on people who are not seizure free when it comes to exercise. And because memory impairments affects all people with epilepsy, that wasn't exclusionary for us. It's just whether or not they thought they had memory issues due to their epilepsy or anti-seizure medications or seizures themselves. We did not take people with intellectual disability because we want to have somewhat of a normative baseline when it comes to that. However, we didn't do any kind of, neuropsychological testing beforehand to include or exclude them. It was literally just the question, do you feel that you have memory impairments due to your epilepsy?
So what was the outcome of that study? What did you learn?
So what we learned was that people who did the exercise improved in their verbal learning and memory function. So in a relatively short period of time, there was a significant improvement in how they recognized words after they've learned it. To learn a list of words, there's about a 30-minute delay, and can you recognize it, later on? And the people who didn't exercise actually had a decrease in that performance, which was, I thought was amazing for just a 6-week time period. And we were also able to look at an individual level, what that looked like. Because sometimes when you look at group, comparisons, everything gets averaged out. And you have to question, what's really happening. And when we looked at each individual, those who exercised, either they maintained their performance or they improved. And those who didn't exercise, you could see the decreases. It's nice to know that with even a short intervention like that, people can maintain their function or improve it.
Tell us about the brain imaging part, which is kind of important in order to see how people's brains have changed or modified in the process of the exercise.
So there's a very particular brain region called the hippocampus that is important in memory function. And we were very interested to see how its connections to other parts of the brain would change with exercise. And so in the pilot study, we saw that, its change in the hippocampus connection was associated or related to their improvement in memory function. And so in this larger trial, we are really looking to test that. Is it because of the changes in these functional connections with other brain regions? Is that what is driving these improvements in memory improvement in people with epilepsy? I'm really excited to be able to see what those results are after we've analyzed the data. But, I think our brain's ability to change is so important because it helps us adapt. And what we're hoping is maybe if we can see what these connections are at the beginning of, say, an intervention, can we predict who's actually going to improve or not? Is that a way to see who can respond to an intervention or not? And so that's why I'm really excited about that aspect of it as well.
What was this randomized clinical trial? What was that all about? And what's the title and all that?
It's called Exercise for Memory Rehabilitation and Epilepsy. It used the same exact intervention as in the pilot study, the combined endurance and resistance training at moderate intensity. And we had a control group that didn't exercise and a group that did exercise. So they were randomized to one or the other. We had wanted to recruit a lot more patients, but in the pilot study, we took all comers. And in this randomized clinical trial, we took a subset of people with epilepsy, idiopathic generalized epilepsy. So there's only about 20% of the epilepsy population that have this. But we focused in on them in general because actually in the pilot, the majority of those patients had idiopathic generalized epilepsy. So we just took that. And also for patients with this type of epilepsy, even though they comprise 20% of the population, only about 1% of research is conducted in this population. So it's a bit disproportionate. So that's also, part of the rationale for focusing on them.
What about recruitment? How many people did you have involved in the study? What were the dropouts? Because there are always dropouts, like it's to be expected. How did that go?
We had recruited 71 participants in total, and we're still going through the numbers because we literally just unblinded last month. And so I was not able to see a lot of the data. And so we're still sorting through that. Not everyone, of course, was able to, complete the study. And in terms of the breakdown between those who, exercised and did not exercise in that first 6-week period, we're still working through those numbers.
It's so interesting because I've been reading a lot lately about, as a world, we're telling everybody that they need to do more exercise. If you don't want to have heart disease or stroke or die early. But it's just so interesting that the more we learn, and I think this has been around ages, but it's not been promoted that well, is how exercise can improve cognitive function. And since that's a thing that's so, as we've already said, is commonly affected by people with an epilepsy, whether it's down to the seizures or whether it's down to the medication or whether it's down to the psychiatric illnesses, which are part of it or come alongside it, it can be so, we have such a need, but then also, you say the word exercise to people and many of us freak out. So
Absolutely.
Right. And
Absolutely.
How do you get over that in your work, and how can we get over that as a species?
In general, I think, exercise, it has a bad rap because you think of it as work, right? And so, I think moving forward, I'm looking at more just physical activity. In general, because, when you look at the statistics, people with epilepsy just aren't as physically active, whether that's exercise or non-exercise, right? Just
movement.
Activity, just movement, in general. But I think, being able to increase physical activity in people's leisure time, not because you have to be physically active for work, right? Because that's work. But something that you enjoy doing, you want to do. I think, focusing in on that will be important. Whether or not just physical activity in general will help improve cognition and cognitive function or memory, that's still to be seen, and we would need to look at that specifically, right? My studies were very specific on being moderate intensity. So we want to get the heart rate up. We want to get the heart moving and the blood flowing to a certain level in order to sort of get a particular effect. And so, whether or not that's needed for this kind of improvement, I can't say because we didn't test that. But regardless, just being more physically active is better for quality of life, right? And feeling better and mood. And we know this in other conditions, why it's not been so focused on in people with epilepsy. There's a lot of things that go into that, as fear of seizures, fear of hurting yourself, or, just maybe even being embarrassed. There's a whole stigma against epilepsy.
I think a lot of the issues are the same as though for everybody else, aren't they? Like people without epilepsy are often scared to go and exercise, or what they perceive to be exercise, or they don't want to be seen in the gym. Not that we have to go to the gym, but that's what we're taught. And so I don't think it's just the people with epilepsy, it's humans in general. It's just that we are even more likely to not get the exercise that we need and more likely to have cognitive dysfunction, and so could benefit from it potentially more than other people.
Absolutely. And I think the lack of guidelines, clear guidelines, is part of that, even though there was recommendations by the International League Against Epilepsy that were published with respect to, level of physical activity and types of physical activities that are safe for people with epilepsy, especially if you're seizure free. And if you're not, in conjunction with your clinician, that you can you can be physically active still. I think that information isn't well advertised. And even a number of clinicians that I know are not aware of those recommendations. So,
oh gosh.
Yeah. So I think, kind of spreading the information, not just to the patients and their family members or caregivers, but also educating clinicians on what these recommendations are. And that was years ago. And so I think updating them too as more research comes out with respect to effects of exercise and what's safe and is going to be really important in the next few years.
I completely agree. But you know what? I think often we look at one step. So some people are worried that understandably, in many cases, if they exercise, they'll seize. But at the end of the day, for many people, if you exercise, you reduce your seizure likelihood because you improve sleep, you improve mood, and those things alone can help to reduce seizure likelihood in many people.
Absolutely. And so it's not a simple relationship, right? But exercise has full body effects, right? Your brain, your heart, your mood. And definitely with sleep. And so again, those are known in other conditions. I think maybe for people with epilepsy, they want to be shown that this affects me too. And there's just so little research on that in general. A lot of the focus has been exercise and seizures, right? Is it seizure inducing? It's not even, does it, prevent seizures? Does it induce seizures? And you look at a lot of the literature, that's what it's been for a very, very long time. And I think we need to kind of shift the mindset with exercise and physical activity in people with epilepsy and start asking the question, what benefits can people with epilepsy gain specifically from that? So if sleep is a huge part of your seizure control, how can it help you improve sleep? What if it's just walking, right? It doesn't have to be full on, going to the gym, lifting weights or being, getting your heart rate up to like 120 or whatever. It's just, just take a walk for a half hour, right? Does that help improve? But we can't answer those questions specifically in people with epilepsy right now because people haven't asked the question.
Everybody listening, if you're a clinician, physician, ask your patients these questions, like how are they getting on? And I think that we should all be getting together to do more studies like the one that you are analysing at the moment, Jane. But also, and then if you are a person with an epilepsy, bring it up or if you don't want to bring it up quite yet with your clinician, then think, actually, let me start recording this stuff myself. And you can sometimes see the correlations between things, which may not be what you expect.
We're trying to grow the literature on exercise and physical activity in people with epilepsy. I understand, it's hard to read some of that literature sometimes, but it is out there and there's open access ones that anybody can access without paying for. If you're a patient, talk to your clinician. If you're a caregiver, talk to your person with epilepsy. Because I think support is important for being physically active and exercising. It doesn't matter who you are. If you don't have that kind of support system, it's very difficult to just do things on your own.
And there are different ways around it for different types of people. Some people don't like to be around others when they do it. Fine, you don't have to be. If you want to be around a load of other people, there are certainly options for that as well. And I know lots of people get worried about being judged when exercising, but again, there are ways around that. And at the end of the day, we want to improve our cognition. We do.
Absolutely.
And so there's a balance. Do we do a bit of exercise, or do we see our cognition remain there and possibly lower? Or do we improve our physical exercise a bit and possibly see an improvement in cognition?
You don't have to go straight to exercise, right? Just get up, walk around, just be more active in general. One way to measure this is less time sitting. So right now I am standing up as I do this podcast with you. Less sitting time can be a metric. So maybe that's a good starting point.
A true thanks to Jane for joining us and sharing her exciting results. Her latest randomised clinical trial has now been completed and unblinded, with analysis currently underway, so do keep an eye out for her paper over the coming months. In the meantime, this raises a practical question for both clinicians and people with an epilepsy. What may exercise actively improve, from memory to mood to overall quality of life? And how can we start integrating that into care in a more structured, evidence-based way? If you enjoyed this conversation, please share it with a friend or a colleague and hit follow or subscribe so that you don't miss future episodes. See you next time.